Mini talk, maternal mortality. Why are Black women dying more often? Definition. The death of a woman during pregnancy or within a year of the end of pregnancy from a pregnancy complication, a chain of events initiated by pregnancy, the aggravation of unrelated condition by the physiologic, physiologic effect of pregnancy. Issues. Maternal death in the U.S. are growing. The numbers are growing and growing and growing. In 2020, 23.9 deaths per 100,000 live births. In 2021, 2021, 32.9 deaths per 100,000 live births. You can see how the numbers then doubled. Well, they went up to 10. And then 9.8 deaths per 100 live birth was the number in 2000. The total maternal deaths in 2021 were 1,205. The total maternal deaths in 2000 was 396. The same thing for the death within, the numbers were the same for the deaths within 42 days of pregnancy in 2021 and 2020. And if you look at the chart, it shows how the numbers rose and then from like around 2019 and 2020 to 2021 the numbers did a very high increase. Risk. Black women, Black and American Indian and Alaska Native women have higher rates of pregnancy related deaths compared to white women. They have 2 or 3 times higher deaths than white women. In the U.S., maternal mortality rate increased nearly 40% in 2021 and was the highest for Black women. And the chart that I have here shows that in 2021, Black women numbers was 69.96, while white women was 26.6, and Hispanic was 28. Factors. Postmortem complications. Maternal mortality can occur during the postmortem period due to complications that develop after childbirth, such as hemorrhage, infection, and preeclampsia. Lack of access to quality healthcare, inadequate access to prenatal childbirth, and postmortem care significantly increases the risk of maternal mortality. This both includes physical access, proximity to healthcare facilities, and financial access affordability. Medical conditions. Pre-existing and pregnancy-induced medical conditions such as hypertension, obesity, and heart disease can increase the risk of maternal mortality. Racial and ethnic disparities. Racial and ethnic minority women, particularly Black women, face significantly higher maternal mortality rate due to systematic racism, implicit biases in healthcare, and disparities in socioeconomic factors. Critically, critically important. Losing life while it's preventable. Maternal mortality is very much preventable. It depends on the healthcare you get. Black women are most likely to suffer from maternal mortality. The numbers might climb to a point where women are scared to have kids, closing the health gap. If nothing is done, more Black mothers might die, might die, babies too. Continued disparities, racial, ethnic, and socioeconomic disparities in maternal mortality will persist or worsen, continuing inequalities in healthcare. Violating human rights, violations of women's human rights and access to adequate health care also puts a strain on the healthcare system. creating a change, expand and maintain access to healthcare coverage. Black women should receive healthcare that is respectful, culturally competent, safe, and the highest quality. Better access to midwives, doulas, and OBGYN. Social determinants of health must be addressed through, through policies that raise incomes and build wealth, provides access to clean, safe, and affordable housing, improve the quality of education, prioritize reliable public transportation and transport for medical appointments, and increase the availability of healthy, affordable food. Discussion. How can community-based interventions and social determinants of health be utilized to address the causes of maternal mortality and improve maternal health outcomes? What are the key components of comprehensive postpartum care, and how can healthcare systems ensure that mothers receive necessary support during the critical post-birth period? Thank you very much.